fact, millions of men and women in this country are suffering from sexual dysfunction, but many are still afraid to get help or don't know where to start other than asking for the little blue pill. But there's much more to treating it than that. Dr. Martin Bastuba is here with some insight. Thanks for joining us this morning, because we're seeing it everywhere. I mean, we got your Cialis, we see the commercials for that, Levitra, Viagra, which was the first on the market. And I'm afraid to ask what this is, but we'll get to this in a little while. This is something that is really starting to get talked about, and that's the best part.
Well, it really is. It's always been common. More than 50% of all males between the ages of 40 and 70 have some degree of an issue. But now, at least, we're finally talking about it and doing something about it.
Emotionally as well as physiologically for men and now for women. It used to be that if a woman had some type of sexual dysfunction, they were called frigid, and they just let it go at that. Well, now they're understanding that they have some of the same physical problems as men, right?
Well, we're sort of catching up to where we were with males maybe 10, 20 years ago, where we're realizing it's not just in your head. There are physical problems that we can do something about, and it's really exciting, I think, for females right now that we're seeing a lot of the male commercials, but there will be a new age in the not-too-distant future where also females will have some of the same treatments, some of the same options.
Does Viagra work in the same way for blood flow for women that it does for men, or do they take a different treatment?
Well, it definitely can increase pelvic blood flow, and in the correct type of patient, it can be a real help. The problem initially was we didn't know how to identify those females. But again, technology's catching up, and now we're starting to identify those females that may be helped by that. You know, that we may well be seeing a pink Viagra in the not too distant future, specially designed for females.
What is this?
Well, that is a kind of a neat device. It is the first FDA-approved device for female sexual dysfunction. And suffice it to say that it can help with arousal disorders. It can help bring blood flow into the appropriate areas and help females overcome some of the various issues.
And you know, the interesting thing, most of the time it was written off in the past about, most of it was psychological, but don't they all play against each other? I mean, if a guy is stressed out or a woman is stressed out and then they're having sexual dysfunction, doesn't that just compound the problem? Once they get the sexual dysfunction, then they begin having psychological problems because of the sexual dysfunction.
Exactly, Stan. Sometimes it's a primary problem, sometimes it's secondary or a response to the primary physical problem. But in any event, it's important that it be treated as well for both males and females. And females, they have sexual dysfunction oftentimes at a younger age than males do. And in that instance, it's more of a psychological issue typically, but we're finding more and more physical problems that we're able to do something about.
How often are these pills effective for men?
About 60–70% of time. They're not effective for everybody, and that's one important message, is to understand that if they don't work, it doesn't mean you're a failure. Right. The products don't work for everybody. We've got a lot of other options we can do, though, and that's exactly the type of thing.
But if you listen to these baseball players, these stock car drivers, and all these other guys, you'd think that, boy, this is where it's at. I mean, you pop one of these and it's all over, and that's a misconception.
Well, they have helped countless numbers of people. But the bottom line is maybe 10, maybe 15% of males with the issue have come out of the woodwork for treatment so far. For many of them, they'll never want to, and that's okay. But they are effective in a high number of males.
If there's a couple at home right now watching and they're dealing with sexual dysfunction with one or both partners, what would you advise them to do, first step?
Well, the first thing I would say is to think about it, talk about it, and then do something about it. Someone like myself that deals with these issues on a day-to-day basis, I'm certainly ready to hear about it. But I can tell you that most primary care physicians, your family doctor, are getting more and more tuned into this. Urologists in general, like myself, spend a lot of their time dealing with these issues. And now more and more gynecologists are getting interested from the female side of things. For myself, when I deal with female sexual dysfunction, being a urologist, I want to be involved with a gynecologist and also a psychologist to sort of have a multidisciplinary approach and really deal with the problem.
Yeah. In this day and age, there's no need to just suffer.
No, there
not
isn't.
with the breakthroughs that are happening
It's
today.
getting better and better, and there's a lot of people out there, about 30 million males and a similar number of females in this country alone.
That is amazing. Dr. Martin, martinbastuba.com is your website, and 619-286-3520 is your phone number. And for anybody who is out there and dealing with this is a good place to call. Jump on the website, and there are many, many other places on the web where people can get some answers. Thanks for coming in.
Absolutely.
Good insight. This is something you talk about for 15 or 20 minutes for people and get to all aspects of it, but I think it's a good jumping off point.
Thanks
For coming in.